Good day everyone. In this video I will explain you how to do wound dressing in the diabetic food. As we can see in this video, first we have to clean this wound properly with normal saline, and we have to make sure that first we have to maintain the hygiene of the surrounding area. So we can see we bring here one uh, garbage box here, and we are throwing all the unwanted things in that garbage box. And uh, and I took this the gauze, the sterile one, and I am cleaning this wound, so there will be less infections later on. So we have to clean the first the infected wound with the normal saline, and so there will be less chances of infection, and it will help in recover as soon as possible also. So as we can see now, we have to clean this wound with the normal saline, and we have to use this gauze with to wipe this uh, water. So there will be, when we use the silver sulfadiazine, so it will not be wasted. If we put the silver sulfadiazine in presence of the moist, there will be no effect by the silver sulfadiazine. That's why we have to make sure there should be no any moisture or water on the affected area. So and always also maintain your hygiene, always wear the gloves. So sometime the infected wound have also there many kinds of bacteria, and it can cause infection to you also. Always wear gloves. So after using the gloves, before going to apply the new gauze with sodium sulfadiazine, so you have to throw that the previously used gloves, so the another gloves will be clean. Or also you can use the sterile gloves if you have possible. So as we see here, I change my gloves. I already throw my previous gloves, so it will be not contaminated to any infections, and I am again uh, cleaning the wound with the normal saline solution, as we can see, and we let the water drain in the garbage box here. And now I'm just waiting for the gauze with the silver sulfadiazine. So before, look, you can see in the video, no, we have to get the silver sulfadiazine on the gauze, and we have to rub like how we wash the clothes with the hand, so it will be spread all over the gauze. And when we put that gauze on the wound, and it will help in the reabsorption of the silver sulfadiazine. And as you look, we are trying to make sure the silver sulfadiazine, this medicine will be sprayed or mix goes to all over the silver sulfadiazine. So now it's already completed, so we have to make sure the silver sulfadiazine and the OS will be properly mixed, so there will be no remaining part that is not and we can also see here, we are also now, before going to apply this silver sulfadiazine with this ESO, so we have to first make the wound dry as much as possible, like how I am wiping this the wound, so there will be no water, no moisture in the wound place affected area, so it will be more effective. So as we can see here, now we are placing the gauze with silver sulfadiazine, and we have to make sure we have to hold so it will not be fall down, and we have to cover the all wound with the silver sulfadiazine, and we have to place the another sterile gauze on the wound, so it will not be fall down. As we can see again here, I'm trying to hold the gauze with the silver sulfadiazine, so there will be no fall down of that silver sulfadiazine. Make sure we have to cover the all infected area, so there will be no exposed infected wound to the surroundings, or so we can prevent the infection from the surrounding area. As now you can see, I am trying to cover the all infected part here, so it will not expose to the surrounding area, and it helps the proper isolation and proper prevention of infection of the wound. Now I'm just trying to close with the gauze. Now later on we have to apply this elastic bandage over that wound, so it will not fall down the sterile gauze, and this gauze with the silver sulfadiazine. As we can see here, we are trying to fix this gauze. Now I already fixed that gauze, so now we have to make sure we have to place this elastic bandage on the right position, so it will not be fall down, or it should not be so we have to make sure we have to wrap well on the gauze on the wound and the affected area. So we can see here I am trying to fix as much as possible how it will be stable to the patient, and there will be no any error when the patient will lie down or when the patient try to walk. So if you have any clip, then you can put the clip over there. You can find the clip in the elastic bandage packet, but now I am just applying this white tape here, so we can also fix with that elastic tape also. If you don't have any clip, then you can use this elastic tape. For now I didn't find my the clip here, so I am trying to fix with this white elastic tape. Now we can show how the brown elastic tape is fixed with this white tape. Always try to fix this properly, so there will be no error to fall down this elastic tape. Now, after doing the wound dressing, we have to remove our